Good afternoon, everyone. First of all, thank you for this kind invitation to speak about this important topic of mobile health. I'm Giuseppe de Carlo from IFA. IFA is a patient organization, it's a European federation, representing people with asthma, allergy, and COPD. So first I would like to quickly introduce our organization. We are active in Europe on three main fields of activities. First of all, advocacy at the EU level, but also implementation of projects. This can be European projects on research or projects that we implement together with our members at the national level. And we also work with the members in developing capacities and in making our network as strong as possible. All these activities are aimed at some key objectives for us, such as healthier environment, access to care, patient participation and equity, and are driven by some core values. Today I would like to give you a bit of insight about what we do for ensuring patient perspective and patient involvement in all activities that we do. So we have 41 member organization in 25 European countries, which makes more or less 500,000 patients in Europe. In the picture that you see here, this is our last annual general meeting in London. Most of the people in that picture have a chronic condition. And their main concern every day is to keep their disease under control. Maybe Paul, you can confirm that.
Yes.
And
just now, as you can see, that I was coughing.
And of course, we think that mobile health has a great potential in this term. And of course, it can enable patients with chronic disease in self-manage their diseases more easily, thanks to the opportunity to better adhere to the treatment, to track the symptom that can lead to avoidance of exacerbations or attacks, for example, in asthma, and also to track the trigger factors. Think about pollen, for example. So people with allergy, thanks to new technologies, they know where there is higher pollen concentration, in which season, in which place, and they can avoid that. Of course, we are speaking a lot today about the challenges in mobile health. Well, there are many, and many of them have been mentioned, so I don't want to go through all of that, but I want to stress on one aspect specifically, which is trust and motivation. As MEP Kylie said before, both healthcare professionals and patients are not that confident or maybe ready to use new technologies, mobile applications, although all of us nowadays use a smartphone. So we had a lot of discussion with our members, and they always ask me, well, I tried to use this application which claims to do X, Y, and Z, and in the end it does completely different stuff. Which can be, well, of course, it makes the application ineffective, but sometimes it can be even harmful for the patient. So we need to build the trust, because people is not that they don't have guidance and they don't know which application can be effective, which can't. So in our small garden, we are trying to address some of these challenges. For example, we are involved in My Air Coach. My Air Coach is an Horizon 2020 project. We are developing a decision support system for people with asthma. So basically, we are now working on a prototype of a smart inhaler, which has some sensors that are able to monitor physiological, behavioral, as well as environmental factors around the patients. These data are sent to patients themselves, but also healthcare professionals that can monitor the health status and the environment around the patient. So what we are trying to do is also to propose a different approach in the treatment of the disease. Before we have the diagnosis, then the doctor develop an action plan for the patient, and this action plan is constantly reviewed and adjusted through visits and meetings between healthcare professionals and the patient that can occur weekly or monthly. Thanks to this project and thanks to a new monitoring system, which also include computational modeling that can make everything more personalized in terms of treatment for asthma patients. And so you see that there's a constant monitoring of the situation and constant feedback from the doctor to the patient, but also thanks to a virtual community among patients themselves, so that they can share their experiences and see how they can handle specific situations. What is the role of our organization? We are not researchers, so our role is actually to provide the user perspective and to make this project user-centered. So we've established a group of an advisory patient forum. They provide continuous feedback to the project consortium through the revision of documents or through consultation with researchers or with engineers involved in the project. They have constant teleconferences and meetings, because our aim is that the final product, the final solution that will arise from My Air Coach will address the specific needs of the patients. We have 22 people with asthma involved in this project from 4 countries. They are really doing an incredible work, although they are completely volunteer. But they feel part of the project and are very excited to be involved in the design of something that could help other patients and other people in Europe. So far their involvement has been quite intense. They've defined the user requirements of the project, of the application at the beginning of the project, and they've inputted in the test campaign by reviewing the methodology. So test campaign that will start next month, if I'm not wrong, will benefit from their contribution as well. And they are starting to give feedback on the usability of the application. I have to say that so far the final outcome, what was in the beginning the final outcomes, has changed a lot, and this is also thanks to these people. They are reviewing the online platform, the virtual community, some educational content that would be integrated in the application. And they're also trying to promote the project and this solution by writing lay summaries or lay abstract. They are also presenting in external conferences. Next week they will be at the EASIM first conference. And they are also contributing to all communication activities around the project. So last thing I want to mention, that was mentioned before also by Carmen La Plaza, is the European Commission Working Group on Mobile Health. As said before, the main goal of this working group is to develop guidelines for the accessibility and reliability of mobile health application. Of course, the working group is focusing on those applications that don't fall under the medical devices director, or maybe we are addressing only those devices at the lower level of medical devices. So we are trying to cover all the spectrum of well-being application that are not covered by specific guidelines or directive. So the group is very varied. There are a lot of stakeholders representing app developers, healthcare professionals, but also patient organizations. So we are trying to give our input and our perspective in this work and to build that trust around mobile health application that can help people manage their condition more easily.